The use of aerobic arm therapy for patients with peripheral artery disease is well publicized now, but back when it was just the germ of an idea in my head, it was the American Heart Association that made it possible for me to put my theory to the test. I had just finished my dissertation on coronary bypass patients when I first presented at scientific sessions in 1998. As a doctoral student, my advisor had encouraged AHA membership, so I had already attended the meetings once or twice. But as my focus shifted to peripheral artery disease, I became more involved with AHA. Some years later, just as I was transitioning in my role to become a faculty member on a tenure track, AHA awarded me a scientist development grant, allowing me to test my novel therapy approach. Since the grant provided salary support, I was able to cut back on my teaching time and focus more on my research, leading to more funding for additional studies. Since then, the AHA created the PVD Council, a great addition, and it's wonderful to play a part in shaping that council's expanding role. Being part of a council makes a large meeting like scientific sessions feel more personal because you're connected to pockets of people with the same interests. The satellite meetings are also a great way for colleagues to meet and collaborate. There are so many great networking opportunities. And of course, as a premium professional member, I have access to the journals, which I really enjoy. I am fond of saying we don't always know what we think we know. Because AHA first gave me the opportunity to pursue an untested idea, I am now able to give supporting evidence about alternative exercise options. I'm privileged to serve on several writing committees that allow me to share my knowledge of what I feel is still an understudied and underappreciated area. It's also my privilege to keep the ball rolling by working with graduate and undergraduate students. One of my PhD students received an AHA pre-doc fellowship some years ago, and I love seeing students get encouragement at such an early point in their studies. I also know that there are many other great ideas out there, and I know AHA will give them the chance they gave mine.